Like to listen to the newest development happening in vaccine development from again Dr. Elizabeth Cohen, and she just actually said that AstraZeneca reports its immunization data, which actually represents a 70 percentile of accuracy, but this is still early development. And their case would actually be likely to affect the people in Brazil and different countries. So the US trial is still going on. So again, it's slightly disappointing because Pfizer actually had a Pfizer and Moderna, they actually had a close to 94.5 percentile or 95 percentile. They definitely brag about much higher number of accuracy, as well as they tested a greater amount of people. Right, that's the reason why AstraZeneca and Oxford immunization data would be slightly discouraging. However, the US trials is still happening and taking place. But another thing is, the AstraZeneca's vaccine so far has been tested to affect 12,000 people. This is also slightly disappointing because the more you actually have people in your pool, the greater the actual accuracy you can guarantee from the efficiency of vaccines or the absence of side effects. The Moderna and the Pfizer, relatively and respectively, have conducted their vaccine trials to affect 44,000 people and 50,000 people, respectively. And they definitely cover almost twice greater or even actually 3 times greater amount of people to have been tested by their vaccines. That's the reason why Pfizer and Moderna probably could have claimed a greater stake in this business. But we have no idea how this would eventually develop, especially the AstraZeneca's vaccine model is still being tried in the United States. The US trial is not fully completed. That's the problem. And the very question Brianna asked is also very interesting. So when will we finally actually get vaccinated? When will people finally obtain their access to vaccines? That's the problem. There are certain different questions, and Dr. Elizabeth Cohen somehow obtained answers from different authorities in the governmental system. She actually questioned multiple officials in the system. There were two different ideas. One from Dr. Fauci and the other from the Dr. Shanane, who's been actually in charge of the warp speed, which is literally a task force for the COVID-19. Dr. Fauci said by the latter half of December, the latter part of this month called December, the high-risk group and those people in healthcare who are likely to be in contact with the COVID-19 very often, they're likely to be vaccinated. Again, this is forecast. Just like the weather forecast, any type of predictions made ahead of time could always go wrong because there could be unexpected circumstances or simply they just miscalculated certain factors. Again, this is a expected forecast. We can never actually secure that this would be done in a projected way with 100% accuracy. There is no such thing as absolute certainty and exactitude in the realm of a prediction and forecast, as we all know from weather forecasts and meteorologist predictions, right? Yeah. And the Dr. Shanghai from the warp speed said, by May, most of people can actually obtain the immunization. So approximately 70 percentile of people could actually somehow get vaccinated. This would be thinkable. And Dr. Fauci said by the month of April, majority of Americans also can actually get vaccination, whether they are actually working for a small private company, whether they were actually being part of lesser riskier groups, doesn't matter. By the month of April, most of Americans, like average Joes and Janes, could probably have themselves inoculated to better protect them against the coronavirus. That's a possible. Let me actually recap the story. Right now, there is another group called AstraZeneca in alliance with the Oxford University shares their own immunization data. They just actually showcased their own the vaccination performance. This data is very young and at its incipient level, so we can never actually guarantee anything at this moment because this is still progressing, especially concerning the US trial data. Because of the people living in the United States, they are still actually being processed. So we cannot actually say that. It's too early to actually say, oh, this is disappointing. Because the latest data that just actually has published it would are likely to involve cases from countries like Brazil or Africa or Southern American countries. So they're not likely to be part of the data extracted from the United States. But its accuracy rate and efficiency rates are likely to be around 70 percentile. This is slightly disappointing in comparison with the most of rivals like Pfizer and Moderna. First, the actual company named Moderna, they've already actually tested relatively 94.5 percentile to affect 44,000 people. That's what has been said. And a Pfizer, their number would be much higher, like 95 percentile, to include 50,000 individuals. Both of the companies, as a leading pharmaceutical giants in the sector, they actually performed their trials to affect much greater number of people, and they flaunted off the greater accuracy. Tell the truth. The actual rates for their vaccine accuracy and efficiency would be much higher than that of AstraZeneca. AstraZeneca is in cooperative mode with the University of Oxford. The Oxford University and AstraZeneca as a pharmaceutical company, they actually work together to develop this vaccine. Today, their co-research and development data on the COVID-19 and the coronavirus vaccination has been shared right now. And the actual accuracy rate is around a 70 percentile. The total amount of people so far have been tested who have been tested for the coronavirus vaccine development was 12,000. It has been reported that 12,000 people were tested for the AstraZeneca Oxford University vaccination development. But if I ever actually share that, everything is really still going on. We have to actually wait and see. One great benefit of the AstraZeneca and Oxford University vaccine is it requires no serious deep freezing. It can be treated just like the cold flu vaccines. That's really one of the greatest benefits. And another issue is the actual trial results for patients in the United States. These type of results still needs to be awaited because many of the cases are not fully reported and shared. That's a problem. So you have to actually, wait and see how things would actually develop, how things would actually eventually be developed, or that would actually develop out. That's a rule of the case. And another thing is, when will be the earliest timeline when we can finally get vaccination as an average citizens? That was really the pending question for many. What would it, when would it be the right moment? The earliest time? That's a question. And I have no difficulty of understanding this kind of question. But again, Dr. Elizabeth Cohen, who's been working as a medical reporter for CNN many years, she emphasizes the fact that she tried different venues to check the authenticity of information. But again, Even those experts at this moment can only actually issue a statement based upon prediction and forecast. No matter how authentic their positions are in the system, they're all human beings. At this moment, no one can guarantee the absolute accuracy or exactitude of a data or forecast, right? Just like the weather forecast, you actually don't watch a weatherman like L. Rock Kirk or Rob Marciano. They would actually make certain projections about tomorrow's weather. These are likely to go wrong, right? Because this would actually be just prophetic or science based empirical data. So anything can happen to change their predictions, right? So there were two main figures in the system. Number one, it was Dr. Fauci, who's been in charge of the National Institute for the Infectious Disease, right? He actually says that the latter part of December, the people who are definitely in need of being vaccinated, like the senior citizens or healthcare workers, they are expected to be vaccinated. Again, this is just a prediction from Dr. Fauci. No one can actually guarantee this would be exactly what is going to take place. Okay, okay. Um, and Dr. Fauci again said